as a patient, we need to not wait. We need to just get in there and resolve whatever issues we think may be just us, because it's not always just us. It is sometimes an underlying issue that's so simple that can be resolved, and just letting it go just isn't worth it. I think I kind of regret that I didn't do this, 2-3 years ago, thinking that it was just something that I could deal with. For a few years, I had been having some women issues where I felt uncomfortable, and I just started thinking, well, maybe it was just me. I was having dull pains that just didn't seem okay. And the more I thought it was just me, the more symptoms I felt like I was having. So I called and I made an appointment, and I was referred to Dr. Tanjanoff, and I went in for what was a well woman checkup. And during his exam, he proceeded to also give me an ultrasound. And during the ultrasound is when we found a fibroid. Our option was to have a hysterectomy, but leaving the ovaries and just removing the cervix and the uterus, and also the fibroid, because the fibroid was attached to the uterus. And that's when he introduced the robotic surgery as an option. This was my first time having a robotic surgery, so I was kind of nervous, thinking, well, it's gonna be a robot doing this work. However, the doctor is behind the scenes. But in doing my research and reading everything, it seemed that it was the safest, less invasive way to go. Prepping for surgery, I was rolled into the operating room, where I then saw all of these, robot machinery around me. And everybody was super fantastic. They were just moving quickly, getting me into place. The anesthesiologist said, okay, I'm gonna give you something to relax you. And next thing you know, I was waking up. And the nurse came over to me and said, you're done. Everything went well, you're finished. I didn't have any pain. I didn't feel anything. But as I got put in my regular room, because the doctor was going to keep me overnight, I realized that I had this fanny pack type bag over my shoulder and to my side, and it was an on-cue pain relief system. It was essentially a ball of medication that was in this bag, and through this bag had a small catheter that was directly inserted into my stomach area where the surgery was performed. So it was sending the pain medication directly to the source of the pain. So during the healing process, those first 3 days, I didn't have pain in my lower abdomen area like I thought I would. The incisions were very small. I had 4, maybe 1 inch tiny incisions covered by bandages. I wish I would have done this a lot sooner rather than waiting. The nurses and the assistant nurses, so now they work as a team, really made you feel comfortable. They did check on you often. They did give you everything that you needed. One special thing that the nurse did was brought me a warm blanket. They had heated blankets, which was something that was kind of, nice touch to it. The doctor also came in, after surgery and checked on me there. So what I'd like to say to all women out there is that if you feel something or you think something, go to the doctor, talk to them, be open about it, have a conversation, because a lot of times we do think that it's just us and it's me, or it's my body, or I'm getting older, but it's not always that. And so to have a conversation with your doctor is extremely important, especially, if you're able to see Dr. Tanjanoff. I would highly recommend it. I think Emanate Health goes over and above with their technology and their resources that they offer patients. So yeah, finding Emanate, finding the doctor, going through this procedure has been life-changing.